So if you're one of the, millions of people dealing with chronic knee pain or that grinding hip arthritis or some nagging tendon issue that just won't go away, you've probably looked into regenerative medicine. The hype around stem cell therapy for joints is, it's just enormous. They promise structural repair, a permanent end to pain. But then you look globally and the options are, well, they're overwhelming. The prices are all over the place. The marketing is relentless.
And that marketing noise is exactly what we're here to cut through today. We've gone through all the research you provided on this, and the core insight is immediately clear.
Welcome to STEMCIERGE, your global concierge for advanced regenerative medicine. Here, we explore the science and breakthroughs redefining longevity and human performance, giving you clarity, confidence, and trusted insights as you navigate stem cell therapy around the world. Let's begin our deep dive.
Success in this field is far less about where you go and far more about how the treatment is actually executed. Your clinical outcome is going to vary more by the quality of the protocol than by the country or even the price tag.
I love that framing. So we're not shopping for a country, we're vetting a medical protocol. Our mission today is to give you that insider knowledge, to spot the difference between real expertise and just slick marketing. So here's our roadmap for this deep dive. First, let's get clear on who this is actually for, who really benefits. Second, we're going to unpack these 5 critical execution factors, the real non-negotiables. And then finally, we'll map out the global landscape, which countries deliver the best balance of safety, quality, and, of course, cost.
Right. And before anyone even thinks about booking a flight, we have to start with realistic expectations. Stem cell therapy is a powerful tool, for sure, but it is not a magic bullet for every single type of joint problem. The research is very, very specific about this.
Okay, let's unpack that. If I have joint pain, how do I know if I'm in that sweet spot for success?
The best studied, most consistently positive outcomes happen in a few key areas. We're talking mild to moderate knee or hip osteoarthritis. And that means you still have some cartilage, even if it's damaged. Also, specific cartilage defects, and then tendon and ligament injuries, like rotator cuff tears or Achilles issues. We also see good results helping with post-surgical recovery.
So we're talking about joints that need support, that need healing, not joints that are just completely structurally destroyed.
Precisely. The goal is to reduce inflammation, to improve that joint environment, and really encourage your body's own tissue remodeling. But, and this is important, the sources all urge caution with expectations for severe bone-on-bone arthritis, or in joints that have major deformities that haven't been corrected biomechanically.
Wait, so if someone has a severe case, maybe their surgeon said, you need a replacement in 5 years, is this therapy just useless for them?
Not useless, no, but the goal shifts. It shifts dramatically. For those severe cases, structural reversal is, it's a highly unlikely. What you can get is significant symptom relief, less pain, better function. Maybe you can delay that surgery, but you have to see it as a management tool, not a cure. The patients who go in with those conservative expectations, they actually report much better outcomes than those who mistakenly expect their cartilage to regrow.
That sets a really crucial boundary. Okay, let's dive into the core theme here. If success is all about execution, what are the 5 factors that separate the good clinics from the rest? The sources call this the STEMCIERGE framework.
That's right. And if you ignore any one of these 5, you are significantly increasing your risk of a poor outcome. Doesn't matter what country you're in. So number 1 is cell source and processing standards. This is the foundation. You're paying for viable, potent cells. And not all stem cells are the same. They can come from fat, bone marrow, umbilical cords. But the sources stress that the processing actually matters more than the source tissue. You need to verify sterility, expansion methods, and, critically, the viability.
What does that viability check actually look like for me, the patient? I mean, a clinic tells me I'm getting 100 million cells. How do I know they're actually alive?
That's the key question you need to ask. A quality clinic should be able to provide what's called a certificate of analysis or similar lab report at the time of injection. Viability isn't just a number. If you paid for 100 million cells, but the viability is only 60% because of bad processing, you paid for 40 million dead cells. The best clinics are transparent about this.
That changes everything. You're looking at lab data, not brochures.
Okay.
Factor 2.
Factor 2 is precision of delivery. This is absolutely non-negotiable. We're talking about imaging-guided injections, either ultrasound or fluoroscopy. These cells are expensive. They're precious. You just can't afford to miss the target.
But wait, if I'm just getting a straightforward knee injection, why is imaging so critical? Can't a good doctor just, feel the spot and inject?
In a word, no. The sources are so clear on this. Skipping imaging tanks the outcomes. It's impossible to guarantee placement in deep spots like the hip or in joints with lots of scar tissue, which most chronic pain patients have. If the cells end up in the surrounding fat instead of right in the joint capsule, their effectiveness just plummets. Imaging makes sure they go exactly where they need to. Now, for the human element, number 3, orthopedic-specific physician expertise.
Okay, so if I find a doctor who's a great injector and offers stem cells, is that not enough? Why does their background have to be orthopedic?
That's a great question. You should care. Because this isn't just about the needle. It's about understanding joint load, biomechanics, how your body moves. A specialist who only does, say, aesthetics might be skilled with an injection, but they don't understand the cause of the joint breakdown. You need a doctor who thinks like an orthopedic specialist first, and then uses cell therapy as one tool in their toolbox.
That makes sense. So we have the right cells placed precisely by the right expert. The last 2 points seem to be about the environment and the patient's role.
Exactly. Number 4 is regulatory oversight and accountability. Countries really differ here. Local oversight, like the FDA in Thailand or national standards in Japan, that influences safety and documentation. But again, the outcome still comes down to that individual clinic's execution. And finally, number 5, and honestly, this might be the most crucial one, rehabilitation and biomechanical follow-up.
This is where it gets really interesting, isn't it? It sounds like this is the ultimate kicker. People fly thousands of miles, spend all this money, and then fail at the very last step.
That's it. The sources are crystal clear. Cells do not work in a vacuum. You can have the perfect injection, but if you don't fix the underlying mechanical issues, the bad posture, the weak muscles that cause the joint stress in the first place, the results just won't last. The clinic has to integrate a rehab plan into the protocol. If they just offer the injection with no follow-up plan, they're selling you a temporary fix, not a long-term solution.
Just a quick break. This episode is brought to you by STEMCIERGE. If you're exploring stem cell therapy or evaluating clinics around the world, visit STEMCIERGE.com and take the free quiz to receive your personalized assessment. You'll get expert feedback on your eligibility, treatment options, and potential destinations, empowering you to make informed, confident decisions in the world of regenerative medicine. Visit STEMCIERGE.com today. Now, back to the episode.
That framework gives us such a critical lens. So let's apply it to the global map. We're looking for that sweet spot. High-quality execution, reasonable cost, good environment. Let's start with the countries the sources flagged as having the best overall balance.
Right. These are the places that tend to hit all 5 of those execution factors without charging an absolute fortune. So Thailand really stands out as the most practical destination. It offers the strongest balance of quality, access, and cost. You're usually looking at around $7,000 to $15,000. They have a mature medical tourism sector, a real orthopedic ecosystem, and crucially, the top centers mandate imaging-guided injections and operate under the Thai FDA. They're a great all-around choice for mild to moderate knee and hip issues.
And what about South Korea? We always hear about them leading the way in medical tech.
South Korea is more specialized. They're the experts in elite sports medicine and cartilage repair, but you pay a premium for it, maybe $10,000 to $20,000. It's the ideal spot for, a complex sports injury.
Okay, moving over to Latin America, the sources pointed out 2 pretty different options there.
Yes. Colombia is known for high-touch, very customized protocols for complex cases. It's competitively priced, around $6,000 to $14,000. Their strength is physician involvement. They excel with patients who have, say, multiple degenerating joints or have had prior surgeries because the doctors designed these really intensive hands-on protocols. And then you have Panama. It's a specialist destination, usually priced higher, maybe $12,000 to $25,000, and for good reason. They specialize in patients who have inflammatory or autoimmune overlaps, like rheumatoid arthritis. Their clinics know how to combine systemic anti-inflammatory treatments with localized orthopedic injections, which is a very specific and necessary skill set.
Okay, now let's look at the 2 ends of the spectrum. The high volume, more affordable options, and then the high governance, premium ones. Affordability is usually where people start their search.
And that brings us to Mexico and India. Mexico, typically $5,000 to $12,000, has that obvious convenience factor for anyone in the U.S. It makes repeat visits for follow-ups much easier. India, around $4,000 to $10,000, has incredible clinical depth. Probably the best cost-to-skill ratio in the world, especially at their leading academic centers.
But I'm guessing there's a huge caveat here, one that ties right back to our 5 non-negotiables.
Absolutely crucial one. When we say quality is variable in these markets, we mean you're more likely to find clinics skipping two vital steps: precision of delivery and cell processing standards. They get to that low price by often skipping imaging guidance or by using simple bedside machines that just don't give you high cell counts or viability. Due diligence here is non-negotiable.
That makes the risk very tangible. Okay, let's flip to the other side. The high governance spots. For the patient who is very risk-averse and budget isn't the main concern.
Then you look at Japan, Singapore, and the UAE. These are premium, easily starting at $18,000 and going up to $35,000 or more. Their value is regulatory assurance. Japan is the global benchmark. They have a national legal framework just for regenerative medicine. It minimizes surprises. Singapore has incredibly strict oversight, a very conservative safety-first model. And the UAE offers a premium hospital environment. These are for the patient who prioritizes governance above all else.
Understanding the map is great, but the sources also mention how often patients fall into these predictable traps and undermine their own success. Can you summarize those common mistakes?
For sure. There are 5 main ones to avoid. First, choosing based only on price. That almost always means you're compromising on cell quality or delivery. Second, assuming stem cells are all the same product. They are not. Third, and this is a big one, skipping imaging guidance just because a clinic offers a cheaper price without it. Fourth, ignoring rehab. That just kills the long-term durability. And fifth, trusting marketing claims over actual verifiable data like that certificate of analysis we talked about.
So, with all this complexity, what's the practical decision pathway someone should actually follow? What's the takeaway tool from this deep dive?
We can really boil it down to 4 clear steps. Step 1, understand your joint, severity, and goals. Get a clear diagnosis. Know if you're aiming for repair in a mild case or just symptom management in a severe one. Step 2, match your condition to the right country environment. Balance your priorities: cost, access, regulation. If you have autoimmune issues, you're looking at Panama. If it's straightforward OA and affordability is key, you vet a top clinic in Thailand or Mexico. Step 3, verify clinic execution standards. Demand the proof. Ask for the lab reports, confirm their routine use of imaging, and check the doctor's orthopedic specialization. And step 4, confirm rehab and follow-up planning. This is where most people fail. You have to have a structured, committed plan for the 3 to 6 months after the injection. That's what makes it last.
This has been so clarifying. The main takeaway for me is that the best destination isn't the one with the biggest marketing budget or the highest price. It's the clinic that can prove it delivers on those 5 non-negotiable areas, from cell processing to precision injection, and so critically, to the rehab follow-up.
And that leads us to the final thought for you to take away. If all the clinical outcomes show that rehabilitation determines the durability of stem cell therapy, and we know that rehab planning is the most common place patients fail, then the true cost of the therapy isn't just the price of the injection. The true cost is the long-term commitment of time, effort, and expense needed for that full biomechanical correction afterward. If you're not prepared for that ongoing commitment, you might be better off saving the initial investment entirely. And that's something to really consider before you book any travel.
Thank you for listening. If you found this episode valuable, please leave us a 5-star rating and review, then share it with someone who may benefit from it. For global insights and personalized guidance on stem cell therapy, visit STEMCIERGE.com to receive your tailored assessment and explore your treatment options with clarity and confidence. And as always, remember, this podcast is for educational purposes only and is not a substitute for professional medical advice. Please consult your doctor before making decisions about your health. Until next time, stay informed, stay empowered with STEMCIERGE.com.